Dr. Tom. Again, you can see some x-rays behind me, so we're going to do a little bit more on the x-rays. Something I hear a lot when I'm talking to people in and out of the profession is that you think that the spine can't change in its structure, can't change in how it's functioning. So we use pre and post x-rays to not only prove what our progress is with a patient, but we want to make sure we're going in the right direction as always, and if we need to make changes, we can use x-rays to do that. So on this here, we're going to show x-rays on this individual. And when we did these x-rays, he was in his mid to late 60s, very active, physically, did a lot of physical work as a profession. So when he presented to my office, he had the major complaints of sciatica, the radiating pains down the leg, things of that nature. So we're going to take a look at the two x-rays that we did. The first one over here, when we first started working with him, a couple of the main points that we're going to make here is that if we look at his lower spine, here's the sacrum, the right side on the film here, he shifts or translates, what we'll call that a translation from right to left as we go from low back, from his sacrum, up into the lower portion of his mid-back. And then you can see this angulation right here is a 70-degree curve from left to right, right in that mid to lower mid-back. So we obviously put a program together for him, and this was done about 6 months down the road after we started care with him. We could take a look at his spine, and he goes from, if we look at that low back, right through the low back, he's fairly straight through there. I'm not going to make a big deal about this. He's nice and straight through here, and then we get to that same spot that we looked at. He was 7 degrees here, and now he's down to 2 degrees here. So that's a huge difference. That's upwards of 70, almost a 71% improvement from when we started to where he is there. And obviously at this point, symptomatically, he's got no low back pain, no sciatica, and doing really well. So the point always is the spine can change. It's about doing the right things to it, the right they're taking them through the right process from the pre-warm-up, the warm-up stages, to the adjustments, to the post-treatment rehab procedures that we do. Do the right thing consistently over a period of time. You can make changes in the spine structurally, functionally. You can do it consistently.